We're just talking about generalities, and we would say it's thicker skin, it's more pigment. Often with aging, people will get, the darker pigmented lesions. Sometimes that's a sign of aging. There can be sun damage even with this more pigment, and you get blotchiness, you get, the brown spots and things.
The thing to remember is that the South Asian skin represents a diaspora of different skin types, and it ranges from, being very fair to very dark. And so within South Asian skin, you'll have components of Caucasian skin, East Asian skin, and, other ethnicities. When you look at South Asian skin, you don't just assume that it's going to behave in one particular way, just because over the years there's been such a mixture of all the different ethnicities that you have a variety of issues that kind of come together.
In Asians, maybe bags around the eye is a little bit more common than Caucasians. Obviously, it's apparent in both, but what happens with Asians more often, and because I do this type of surgery, we see more of the fat pads. There's generally a little bit more fat. There's more fat around the eye with aging, and collection requires removal. And with Caucasians, there can be fat accumulation, but often it's the loss of fat around the orbital rim. When we're doing surgery, we end up being a little bit more careful about trying to prevent scars.
There's several issues that are very prominent among South Asian skin. First one is the under-eye hyperpigmentation, which is very much prevalent, and that's one of the things that a lot of the men come in for because of the appearance of the eyes always feeling tired, the skin underneath the eyes looking darker. So that's huge. It's extremely prevalent among South Asian men who come in. The second issue that's quite significant is the presence of post-inflammatory hyperpigmentation, especially occurring after inflammatory conditions such as dermatitis as well as acne.
So men of African ancestry represent a geographically and culturally diverse group, but they share some basic hair structure and grooming characteristics, including the tendency to have to groom the hair and the beard in certain ways, and the structure of the hair is common across this group. The follicle tends to be curved, giving rise to a hair shaft that is curly or coiled shaped. And this has implications on skin and hair disorders. So there are a number of skin and hair disorders that disproportionately affect men of African ancestry. These include pseudofolliculitis barbae, acne keloidalis nuchae, and dissecting cellulitis of the scalp. One of the treatment options for pseudofolliculitis barbae is laser hair removal. And that's really been the greatest advance in the management of this often difficult to treat disorder. The greatest advance that we've seen over the past 10 to 15 years is the development of lasers that can be safely used in this population. And there are certainly nuances to which lasers to use and the types of settings that one uses in this skin type. Specifically, the safest lasers are the long pulse 1064 nanometer ND-YAG lasers. And when using conservative settings, including lower fluences and longer pulse durations, we can perform this treatment safely.